My name is David Ward. I'm a registered nurse by profession. I worked for many years in the acute services of health, 20 or 30, too many to remember. But I realised at some point in my professional career it was more important actually to do work in the community and look after people in their own homes. I was fortunate enough that a few years ago that I started working with Carewatch, because I believe they upheld what my values and morals were and what my parents was, which was to look after people in their own homes, maintain their independence and improve their quality of life. I think I've been successful in that role and helping Carewatch, and they've been very good to supporting me, that I've been able to use my skills, knowledge, experience and aptitude for looking after people in their own home and to maintain their independence. I hope I've made a really great difference to people's lives. We've had the privilege and the honour of actually looking after many people of many different ages, suffering from many conditions such as dementia, Alzheimer's, Parkinson's, long-term conditions, health-related conditions, as well as mental health. And it's very important also that we did focus, which we did develop, in living care for people, and especially respite care for carers. One of the best things about working for Carewatch is the way that they employ people and look after them as well. Our carers that we employ come from all backgrounds and all ages, but what we look for in our carers is that they're trustworthy, honest, and they have compassion, true compassion for the job that they do and the professionalism. This is reflected in the team that we work with within the branches, from the registered manager to the care coordinator to a field care supervisor to a deputy. And what's very important as well is our staff stay with us for a long time. Some of our staff and our colleagues have been with us for 20 years plus, right through to retirement. And I think that's a credit to us. But it also means that our staff, the people we work with, our colleagues, have career progression. And they can start as a carer, which is a very important role, and they can progress their career through to a registered manager if they wish. You know, people view this role, a carer's role, as something which is straightforward. You go visit somebody in their own homes, but it's just so much more than that. A lot of the time we're dealing with people with dementia, but you're dealing with not just that person, but you're actually caring for the whole family. And it's so important to include the family in everything which is done. So a carer is not just a carer for an individual, they're actually a carer for a whole family. And it's so difficult for the staff. But to their reward and their justice, they're very professional and very caring. And it's difficult. They may go to a client who has dementia and they may visit them six times a day. And during that period, they'll visit them and they may not even be remembered between one episode and the next. But it's so reassuring for the family and the friends to know that there's an individual going in to visit their relative who may have dementia but is supported and loved and cared for. All our staff receive extensive training and ongoing support, especially so they can feel confident and comfortable in dealing with people who do suffer with dementia and handling medication. Caring for somebody is more than looking after them in their own home. It's about community inclusion. And at Carewatch we've introduced many things to help with community inclusion, such as gardening clubs, cinema clubs, breakfast clubs, and also a Sunday lunch club, which people are invited to in the local community. I find these things are very important because it means people get to meet people who they wouldn't usually meet, and it also adds value to their lives.